What does a lumbar brace really do? Here's the answer. It's a support that needs to have anterior and posterior and lateral control systems. It's a fitted brace that limits excessive rotatory movement. For example, injury or increased stress to a facet joint and surrounding structures creates inflammation. When the patient moves an inflamed area, this motion creates more inflammation. By wearing the brace appropriately, the patient limits the anterior, posterior, and lateral rotatory movements, and this allows inflammation to be decreased. For example, let's say in your office you have a patient that presents to you with chronic exacerbating low back pain. In fact, how common is this in your chiropractic practice? The patient's past history may include medications from their family doctor, physical therapy, been to other chiropractors, been through rehab, done exercise, weight loss, been to yoga, acupuncture. Maybe they've had spinal surgery that didn't work out. How common is this in our practices? I don't know about you, but I see this every day in my practice. The clinical presentation will often show you signs like this: antalgia, muscle spasm, decreased range of motion or increased range of motion, motor weakness in the lower extremities, balance difficulties, showing you they have a weak core, problems with heel and toe walking, poor functional testing such as the get up and go test, hyperlordosis or hypolordosis, or the patient reports to you that their back clicks or pops on its own all the time. Your testing shows some or perhaps all of the following: disc degeneration on X-ray or MRI, disc bulging, disc prolapse, disc herniation, stenosis, central or foraminal, spondylolisthesis, with or without a pars defect, misalignment, osteoporosis, spurs, facet hypertrophy, instability on motion studies, past spinal surgery, sciatic nerve involvement. All of this testing is indicative of lumbar instability. Diagnostic possibilities, and this is important: 729.20, neuralgia, neuritis, radiculitis; 724.30, sciatica; 729.1, myalgia, myositis; 724.5, unspecified backache; 847.2, sprain strain; 724.2, lumbago; 724.02, stenosis; 722.2, lumbar or lumbosacral intervertebral disc; 722.52, post-laminectomy syndrome; 738.4, acquired spondylolisthesis; 720.00, ankylosing spondylitis; 721.30, lumbosacral spondylosis without myelopathy; 724.4, lumbosacral neuritis or radiculitis; 722.93, unspecified lumbar disc disorder; 724.90, other unspecified back disorders. You can also use lumbar instability syndrome, chronic facet syndrome, and others that may justify the use of bracing for stabilization. All of these diagnoses justify the use of lumbar bracing for stabilization. Just make sure the clinical presentation warrants the need for using a brace.